As a country, a state, and a region, we are facing significant health challenges. In order to improve health, we must have a broad community conversation that focuses on where the system could be failing.
In some ways, I think a new way we're thinking is how to collaborate with many different organizations to look at the whole diversity of our region and strengthen relationships so that we're not replicating efforts, but rather we're complementing and strengthening our efforts to improve health.
Committed to community health since being founded more than a century ago, making investments in the community, because that community is what made Carilion. One of those investments is the Community Health Needs Assessment that's done in 6 different areas, including the Roanoke and New River Valleys, Franklin, Giles, and Tazewell counties, and the Rockbridge area.
It allows us to fulfill our mission, which is to improve the health of the communities we serve. If we don't have the data, we don't know whether or not we're doing well, whether or not we're making the impact that needs to be made.
This New Horizons Dental Clinic is just one example of a service created because the Community Health Needs Assessment showed a need for accessible dental care in Roanoke. The United Way of the Roanoke Valley is one of more than 50 organizations partnering with Carilion for that positive change.
For the first time ever, we had a strategic focus around oral health. And so we were able to support efforts like opening the community dental clinic here at New Horizons, and that has opened up a lot of opportunities for people in the community to get that service.
Pat Young leads Healthy Roanoke Valley and the collaborative efforts of our community organizations.
The Community Health Needs Assessment is really that piece of work that drives the evidence-based decision-making in our community, that identifies needs in a way that we can't just do by mining data from a state or a national resource. We are gathering information at a community level, and so we're able to identify neighborhoods and populations that need help that we probably wouldn't be able to identify if Carilion didn't put the work into their Community Health Needs Assessment.
We take a really unique approach with our needs assessment. Rather than it being a Carilion project alone, we partner from the beginning with community health agencies, governments, nonprofits.
Well, it gives the community an idea of what their resources are and where they can go to get their needs taken care of.
Roanoke City FIRE-EMS is one of dozens of agencies that are part of Carilion Clinic's community network. Captain Alan Austin has been with the department 26 years and has seen health needs increase. The city went from 3 medic trucks to 8, with 1 part-time medic truck and a second on the way.
It's important that we do get a partnership because we work so closely with the local hospitals at Carilion, transporting patients and basically directing people in the right direction of the care that they need.
For me, health means a lot of things. It means living in a safe environment, having clean water, having healthy food, living healthily despite whatever stage of health you may be in.
Through the Community Health Needs Surveys, Carilion will continue to strengthen those community partnerships. The efforts are ongoing to learn more about the specific health needs in our region and find ways to facilitate meeting those needs. In Roanoke, Karen McNew for Carilion Clinic.